Perfect. Your life.
Okay. Hi, everyone. Thank you so much for joining me today for another tips and tricks and treatment planning session. Today, I am going to be talking about a case that seems really straightforward. However, there are, you know, tips and tricks or items that are on my checklist when I do a case like this. Particularly in this case, it is a space closure case. As you can see, the patient has a bite of an edge to edge in the anterior and some spacing. Firstly, we always have to, diagnose and find out, the cause of the problem. In her case, a lot of the problem was attributed to her tongue thrust. So she said she had braces in the past, and over the years, without wearing retainers, spaces started forming again. So she really wants to close these spaces. So I had talked to her about her tongue thrust, and she said when she was young, they did have an appliance and give her some information how to swallow properly. And I actually reviewed that with her. So even without starting the case, I mentioned to her, number one, tongue thrust is very important to address. And also retention is very important at the end. So with regard to tongue thrust, I always, let my patient know that, they need to do self-training. Self-training is very important. And one of the key things for self-training that I find very useful is using like a little candy, like a lifesaver. You see those little candy that looks like a little round, little tiny round donut. And you can use the tip of the tongue to put it right through the hole and then put that candy and hold the candy on the top of the palate. So by holding that on the top of the palate, then the tongue has to, have some force. And so it reminds the patients, by sensing that position and then doing the swallowing. So they'll practice with a lifesaver or a candy like that, and then they will practice swallowing. And I told them to, have the candy, throughout the day. And so that, they can practice throughout the day. Every time they swallow, always keep the tongue in the candy, tip of the tongue through the candy, and hold it on the palate, on the roof of the mouth, and swallow and swallow. So every time they feel like swallowing, they have a candy in their mouth. Hopefully it's sugar free. That would be better. It'll, if it's a mint, it'll keep their breath smelling good. And also they would train their tongue. So that's very important. We always need to know the cause. Secondly, of course, throughout the treatment, I always tell her this is all, money you're spending, the time you're spending. At the end, retention is super important. So for cases like this, I always give them either, multiple forms of retention. Like I would give them a fixed retainer as well as a clear retainer to go over it. And on top of that, I would give them multiple clear retainers. I would give them at least two sets because some patients don't, for example, the patients that don't like fixed retainers, I would give them multiple sets of clear retainers because just in case they lose it, so many patients lose retainers and then they kind of just let one day pass, a week pass, a month pass. The next thing you know, they don't have retainers for a year and spaces start, developing again. So I always give them backups and I tell them to keep it next to their passport, somewhere they will never lose their retainer because they're not going to lose their passport. So that's kind of, conversations that I would talk to them about. This patient, she's very sweet, she's very nice, but she said to me that I want to get these spaces closed, but I don't want to wear any attachments. And as you can see, fortunately, most of her teeth are and roots are, in nice positions, nice enough that we don't really need to worry about tipping the roots much. One of the options that I did talk to her is putting some attachments just for retention on the bicuspid areas. Usually I try to put them on the canines and the bicuspids, and this way it'll hold well as we bring back the teeth. She didn't want it, so I had to really kind of just nag her and then really really push her push her to remind her to wear the line. Um, so this is the case. Skeleton, with regard to X-rays, panoramic wise, I check cavities, I check, and she's basically skeletal class 1, pretty straightforward. So what I'm going to do is show you her models here. This is her models at the beginning of the treatment. So as you can see, we scanned her and we brought her in, and you can see the spaces that she has. And she has small lateral incisors, either pretty asymmetrical. So I did mention to her, I said, in order for the fit, right, the occlusion to be ideal or as ideal as possible with the bones, with the jaws, with the teeth that she has, perhaps she's going to end up with some spacing on the distal to the laterals, and she's going to need some bonding at the end. And she was totally fine. Matter of fact, she said if she doesn't want bonding, whether that's okay. And I mentioned to her, I said at the end, we can look at it and see if she's okay, with her aesthetics, either with or without bonding. So for this case, I have 24 liners, and what I did is pretty straightforward, right? It looks straightforward. It looks like all I had to do was bring in the top, based on her facial midlines. And then for the bottom, if you can see, I brought it in and closed it a lot. But there's a number of things that I also did while I treatment planned this case, and I just want to mention that. Number one, I didn't use any attachments, right? So I mentioned I didn't use any attachments. And number two, with regard to the way I set this case up, I told her that she needs to wear her aligners 2 to 3 weeks. Okay, I said 2 to 3 weeks, or else there's no way I'm going to be able to help you, because I want to make sure everything I do really, really gets, achieved at each step. And once again, I told her, I said, every aligner you wear, so let's say she's on number 3 and she's moving to number 4, every single next aligner that she wears has to feel almost like the last one. It's almost like wearing the last pair of aligners over again, because a lot of patients, I mentioned this at the last lecture, but a lot of patients tell me, oh, I feel like it's working because it's really tight. It's getting tight. I tell them, if the liner is getting too tight, that means your teeth is not tracking. So if you're on number 7, your teeth might be still on number 4. However, if your liner always feels loose, that means your teeth is so close to the next aligner, which means it achieved the movement and it's tracking. So every aligner should feel very, very comfortable. No aligners in any treatment should feel too tight. So I just want everyone to know this little tip, which they can tell their patients. It's like, if you wear your liners and everything feels the same, just like the last one, that means moving along well, because the movements are so small. So that's very important. The other part about this treatment is, as you can see, what I overcorrected a lot, right? So we all know that, closing spaces is not easy, and there's a lot of root to be moved, and so always overcorrect. So you see that I have a lot of IPR that's showing. However, I'm not doing these IPRs. This is just, showing me that it is going to be nice and tight. It's like a power chain that we put on fixed appliances. It's not going to crumble the teeth or anything. It's just going to make it tight at the end. So from the very beginning, I have programmed in overcorrection. The other part that I want to mention to you guys, which is really important, is if you look at the roots, you know, when we translate teeth, we always understand the roots, needs to be um, helped in a sense. So in this case, if you look at the roots in the very beginning, the roots are more labial compared to the bone, but towards the end, the roots are more lingual, or the roots are torqued lingually. So this is going to help with the translation. Okay, it's going to help the teeth, preventing the teeth from tipping, because if you don't, the teeth are going to end up tipping back, on the incisal front. So having more torque, lingual torque for these roots, it's going to help. And once again, I said this last time, what you see is not what you get, right? So you have to envision what you get at the end. So with more lingual torquing of the roots will help you translate, okay? And at the end, where is it going to be? It's going to be most likely somewhere along this line, right? Not all the way in, although it looks like I'm bringing it in a lot. The other option that I always add is I look and I add more intrusion. I add more intrusion, especially for the anteriors. So for the anteriors, even on the upper and the lower, if you look from the beginning, I add intrusion. So if you look here, let's say, you will see that the teeth are all being intruded a lot. And this helps because when the two factors, right? Number one, it helps grab onto the anterior teeth in whichever direction you want to move it. Because the occlusal force, when you wear these aligners and you bite on the aligners, it will push down more. It'll grab the anterior dentitions more. So I always add more to a bit of intrusion to any tooth that I really want to move, or has difficult movements. So in this case, because the anterior dentition needs to come back, I added intrusion so that when she puts it on and she's biting and when it's holding, the anterior is going to be moved more. And then, and as well, with regard to the open bites that people get, in the posterior by wearing aligners and, due to the thickness of the aligners, by intruding teeth, it'll prevent that excessive premature anterior um, interference towards typical treatments. So I always intrude the anterior and I always intrude the teeth a little bit for the ones that I want uh, more powerful movement for the aligners to grab more. Um, Now, so we talked about, wearing it longer. And then we talked about no attachments. And with no attachments, this is another part where I do the intrusion in the anterior because with no attachments, when I intrude the anterior a little bit, you know, when they bite down, the front will always grab more. So it kind of helps. Okay. Um, that's basically, some of the points that I want to point out here. So if you look, there's more lingual torque, there's a bit up, there's intrusion. And then finally, I want to mention that always expect to do occlusal adjustment throughout your treatment. Maybe not in this case, but over here you can tell, there might be some interference as this is occurring. as you're moving this particular canine back. So you always have to watch for premature contacts, whether you're closing spaces or distalizing or whatnot. So let me go back to here. This is her pre-treatment, and I have to say this patient was so good with wearing aligners, so good. Um, I'm gonna show you her progress, which is 315. So this is her progress. And if you look at her progress, this is March 15, and the other one was May. So from May to March, this is about 10 months of treatment. And if you look, she has nicely aligned teeth. Everything has, all the spaces has pretty much closed. Um, on the top as well, and you can see that distal to the laterals there are some spaces, and these spaces is obviously due to Bolton discrepancy, and she chose to leave it. She said she wanted to wait because she just felt like it just improved so much compared to before. If you look at her overbite and overjet, you can tell that she has a nice bite. It's not intruded as much as you saw on the um, as you can see, it is not, she does not have an open bite. It is not intruded as much as, what the treatment plan for the aligner shows. And so keep in mind, if you want to do intrusion, you always got to overcorrect and intrude more than needed. So looking at her records, she came in May. She got delivery in May, like I mentioned. We gave her a new scan in March, so that's 10 months later. I think that's about 40 weeks. And she had 24 liners. I think 40, let me calculate this. 40 weeks divided by 24 liners is 1.66 weeks. So she didn't even wear it, 2 weeks each, and I had mentioned to her 2 to 3 weeks. And I think what happened was she started with it like that. And later on, she was so good, I told her to wear it less. So I believe she probably ended up with a 10-day wear. Because of cases like this, you really do need to watch out for fenestrations and cortical plate. You don't want to move the root. It looks like you're gonna move the root, completely out, of the bone. But reality is, this is what you see is now what you get, right? So you're really moving it, much less. And if you do it really, really slowly, the bone does remodel, right? The bone remodels, and just like a lot of the buccally verted or lingually verted crossbite canines you see, or laterals, and we would put an open coil with braces and bring them forward. They're all brought forward, sometimes 3 to 5 millimeters, and at the end, the labial bone is fine, the cortical plate is fine, they don't have any recession, and the reason is we do it with light continuous forces, and we let the bone remodel. um, so let me show you here. So she came in, here we go. So, so, so I given her four liners, four liners, four liners, basically four liners at a time. And the reason is I have to watch, right? You really need to be careful. It's a 1 minute appointment. You come back, you make sure she's wearing her liners, you make sure liners are going in and out easily. You talk to the patients, ask them about any signs or symptoms, that they're feeling. I mean, everybody's bone structure is different, everybody's biology of the body is different. So for a case like this, you gotta make sure you keep up and make sure their periodontium is healthy, while this is happening. Um, so this is March. She came in on this date. This is the scan. I think I showed you the picture already. So, yep, this is the March picture. So I'll put it on full screen. And once again, everything seems to have improved a lot. And there's no refinement in between, right? There's no refinement in between. So once again, this is when she came in. So this is when she came in March. everything, all their teeth are aligned, everything's nice and successful. If you look at her bite, you can actually see some space here. And this is what we want, right? We want spaces here. We want we want occlusion in the back, and if anything, super light contact in the front, or more or less no contact in the front would be nice. And a lot of times you got to look at, the anatomy of the lingual marginal ridges, right? Sometimes they look like a little shovel. So on the marginal ridges, you got to look, for example, on the mesial or distal part, a lot of patients, here's another tip and trick. You got to occlusal adjust, okay? You got to occlusal adjust. We're making the puzzles fit. So, occlusal adjusting as things moves are very important. And if you look here, also, you see how the canines and this canine, there's no space. I mean, there is space and there's no contact here. Whereas if you look at, let's see, if you look at her previous, do you want to exit? Do you want to save? No, keep that. If you look at her previous original treatment plan when she got started, it was predicted that there would be some contact. So if you look here, do you see how at the end you do see some contact here, right? But for her, when she came in later, there's no contact. There is a chance that I might have done some occlusal adjustment. I can't remember, but I always look. I always check the contacts. I always look at lateral excursions. It's important to remember, you know, mutually protected occlusion is super, super important, especially when you're doing orthodontics. So over here, there's only a little bit. Over here, there's space. These are nice. The back, the contacts are good. Um, Everything's nicely aligned, so she's in good shape there. So once again, a few things when you do cases like this, you got to anticipate, with regard to the roots, if you're bringing them in or laterally or whatnot, you have to add a bit of a lingual toric or palatal toric to the roots of the upper anterior if you're doing retraction. Always, program it so that they have some intrusive forces in the fronts so the liners will grab better, especially with the ones that don't have any attachments. And fortunately for her, she didn't need any attachments. So all this done was no attachments. Actually, check it out. So this is where she started. So there was a little attachment. I mean, there was a little contact. So this is where I want. So I take that back. When she first came in, there was contact here. And this is what I treatment planned for the refinement. Okay, so the refinement, um, it's actually here. This is where she came in. I'm sorry about that. And then at the refinement, you see how I aimed? I wanted no contact here. So I did do a 4 aligner refinement for her. And let me look here. Progress, final. So this is her final. Um, Let me do a full screen. So her final, I have some contact bites and marks. So I always check their occlusions. We always want to double check everything. You can't really see it here, but there's a little space here. You know, I check the contacts everywhere to make sure it is balanced and it is nice and even. So this is when she finished, which is November. I had her wear the 4, I guess you can call it refinement aligners, or you can call it active retainers. I had her wear it a long time. And the reason I did is because I really don't want things to pop back open the space. So I said to her, for cases like this, I would say at least wear it 12 to 16 hours every day. Wear it during the day, but don't stress yourself, and make sure you wear it every moment at home and at night. And then I have them wear this during this period. And then let me go back here and see the end. So this is the end of her treatment. So this is where I made the retainers for her. Okay, so this is where I made the retainers for her. So she finished here, and if we look, she still has a little contact here, but she has contacts all around. As you can see green marks all around, right? The reason why this is showing is because I've occlusally adjusted her, and that this is where I felt most comfortable for her, so that she has a nice occlusion, nice bite, and nice and even, and that's where I finished. So this is a full screen. So with this case, um, you don't need attachments, but of course attachments would help. Remember to intrude, the anteriors. Remember to add lingual torque. Remember to do occlusal adjustments. And remember to, see your patients often. Uh, as I mentioned, if you look at our beginning photos, there's certainly the bone, for these to close, you really do need to make sure that everything stays healthy. And I'm going to take the final one here. Let's see. Pause it. Final. Um, So if you look at her gums, everything is nice and healthy. You always want to check for fremitus or mobility. You can't really see the back here, but I checked that and make sure she was okay. Perhaps I can show it to you with this one. Let me see, because we did scan her. So see, you can always go back and look at your scan. And then look at the gum health. Look at where the inclinations of all your teeth are. And for her, this is her back, and you can see that everything is nice and healthy. She has, you know, very nice gingiva. There's no recessions. Everything stayed healthy, and yeah, it's very achievable. Don't be afraid to move teeth, buccally or lingually. However, you definitely need to be aware and be careful and track it all. So today, um, this is a pretty straightforward case. Um, if you look at her treatments, I mean, I basically saw her first consultation. I delivered the first one. And then so as she started treatment, there's one, two, three, four, five, six visits. And then I scanned her. Wait, hold on. One, two, three, four, five, six. Yeah, six visits. Then I scanned her for refinement. And then it delivered the refinement. And then I think there's one, two, three, four, five, and I scanned her for clear retainers. So I know that a lot of doctors will give the patients, a lot of aligners to wear, and so that you don't have to store aligners. But at least, do a virtual phone call. You can do a Zoom meeting, or you can um, talk to them on the phone, make sure their teeth are healthy. I personally like it, when there's a personal, doctor-patient relationship. I ask them to drop by for me just to see them for a minute, make sure things are okay in case I need to adjust or take a pause on the treatment. So yeah, very straightforward case, but it changed her smile, and she's super happy. I mean, at the end, she did not choose to have a fixed retainer, but as you can see here, at the end, I delivered 3 sets of clear retainers for her. So I gave her 3 sets of clear retainers, and the reason is because I want her to have backup. I want her to always know that in case something happens, I'm not around, or basically there's no excuses, and that having a retainer is so important for her situation. So this is a short presentation, but hopefully some of the tips and tricks and techniques I provided will help you guys all today. and in the future, of course. All right. Thank you for joining me. And for those of you who's going to AAO, I'll see you guys there. Have a good one. Thank you.
Thank you so much, Mario.
Thank you.
Thank you.
Anyone have a question? No, no one have question, Mario. Well, I think that's it, Mario. Thank you so much.
Yeah, any questions, reach out to me, reach out to anyone, anytime. Thank you so much, any one of us. Thank you.
People speak in Portuguese, say obrigado, that means thanks.
Appreciate the opportunity today. I'm going to see you next time, okay? Thank you.
Of course.
Have a good one.